We're seeing a lot of running injuries at the moment. Running injuries are overuse injuries for the most part, unless you're unlucky enough to trip over a curb or a lump or a bump on the ground. Running injuries most commonly are overuse injuries. And the big problem that we see, and this happens in women postnatally trying to get back in shape, or people in January trying to lose the Christmas flab, or at any stage in the year when people decide, right, we're going to embark upon a program, is that people get enthusiastic, they start to run, they get out there, but they don't realize that their body is not fit for the running that they're trying to do. So it's very important that you make your body fit for what you're trying to achieve. So whether it's a 5K or a half marathon or whatever you're going to do, is your body strong enough to try and train towards that goal? So this is really the main reason why people end up in physio when they try and do, sort of a running program. So the typical things that we would look at and sort of the typical tips that you should look at when you're embarking on a program would include things like making sure that your ankle movement, that there's no difference between the ankle movement on the right and the left side. A lot of people have a history of ankle sprains from their hockey days or their footballing days, and then in their 30s they're trying to run a little bit more just to try and keep in shape, but the ankles have borne the brunt of all these sporting injuries. Basically, they're stiff, the ligaments aren't strong, and that can cause a huge problem when they try to run. Another thing that we typically see with the runners is weak gluteal muscles, weak buttock muscles. And this is very easily rectified. There's lots of easy exercises that you can do, with a bit of TheraBand, or even just using the resistance, the weight of your own leg to do it. So typically one of them would be the clam. There's lots of ones that you can do on all fours, and you can be guided by your chartered physiotherapist if you need a little bit of help in this, but certainly weak glutes are a huge part of the running injuries that we tend to see. Another thing that we really see a lot of is people running and they don't have the flexibility to run. So they're not able to, bend the knee up as far as it should go. They're not able to rotate their hip inwards or outwards, the same on both sides, and again, as far as it should go. If you're trying to run and you're trying to build strength on a frame that's not flexible, if you're not able to move your joints through the available range of motion, you shouldn't be running until you can do that. So then you'd look maybe at a yoga class or some stretches yourself on a daily basis until that time that you're able to move well, and then you try and build the activity intensity on top of that. Often we see people who come in and they've had a niggle on their right knee. Previously they had, an ache in their right hip 6 months ago, and then, their ankle was a problem maybe 3 years ago. If we see a pattern of injuries all on the same side, typically we're looking at a core strength issue. So we're looking at weakness in the stomach muscles, we're looking at weakness in the gluteal, the buttock muscles again. So it's important to bear this in mind. Anything that you're trying to do to improve the condition of your body, make sure your body is fit to do it first. There's lots of things that we can look at. If you want to come in for a screening, we can do that. Or if you want to work away with it yourself, you can check through these things. How is your core? How is the flexibility in your lower back? How are your hip rotation movements? How is the flexibility of your quads and the front of the thigh? Do your knees move without crunching and creaking and pains? Are your calves nicely mobile? Are your ankles mobile? One big thing that I would invest in if you're starting to run is a foam roller. It's a fantastic bit of kit. It's a cylindrical shaped sort of polystyrene hard roll, and basically you can use it on all of your muscles, and it's like having a physio at home in your own house, just rubbing out all of the muscles. It gets rid of lumps and bumps and muscular tension, and it's a very effective way to prevent running injuries happen when you're starting a new program. So the most important thing, if you're trying to get fit, make sure that you are fit to run.